Welcome friends, welcome to our next learning session. Good morning to all of you. I am going to talk about the cancer of the gallbladder. But before going to the cancer, we should know what is the gallbladder. Gallbladder is a small pear-shaped organ on the undersurface or beneath the liver. To make it more clear, I will say that if the person is standing, the surface of the liver which faces your feet, that is the inferior surface, and if you lie down, again the surface which is facing your feet is the inferior surface or beneath. That is what we are saying, beneath the liver this organ is there. Now see this diagram and to understand it properly. What is this? This rounded shadow, this globular shadow is the gallbladder. What is its function? Liver produces bile which is used for the digestion of the fats. This bile is stored in this organ, that is the gallbladder. From gallbladder, this portion goes to this is a small tube. This is called cystic duct. This goes and joins here the common hepatic duct. This duct, you see, this is the right hepatic duct. This is the right hepatic duct. This is the left hepatic duct. Hepatic, for those who are not doctors, these are the two tubes coming from the liver. One on the right side, that is called right hepatic duct. The other tube is coming from the left side of the liver, that is called left hepatic duct. Both joined together form the common hepatic duct. It becomes a common tube. Again, I will try to make you understand this anatomy, that from the right side the bile produced by the liver is brought by a tube. This is called a right hepatic duct. And from the left side the bile produced is brought by a tube called left hepatic duct. Two joins together form the common hepatic duct. Now common hepatic duct is joined by the cystic duct, and this forms the common bile duct. This is what is important for you to understand, that this pear-shaped organ is the gallbladder. The bile is stored in this gallbladder, and through the cystic duct it enters the common bile duct, and then it goes to the intestines for the digestion of fats. Now, to show you the cancer of the liver or cancer of the gallbladder, I make you see this diagram. Yeah, see this diagram, and what we are seeing in this diagram, you can see this is the gallbladder, this is the liver, this is all the gallbladder. You can see it very well here, like this. This is a globular pear-shaped organ, and this is the cancer in the gallbladder, and this is the cystic duct which is taking bile to the common bile duct. So this is the cystic duct, this is the gallbladder, this is the bile duct, this is the bile duct. This duct is the bile duct. See this, I will try to make it more close to the screen. This is the bile duct, this is cystic duct, this is the gallbladder. Now see one more diagram. What do you see in this diagram? This structure, globular structure, is the stomach. This structure is the stomach. This is the left lobe of liver. This is the right lobe of liver, and this is the This is the duodenum. This is the duodenum. That is the first part of the small intestine. You know, small intestine has got three parts. The first part is called duodenum. The second part is called jejunum, and the third part is called ileum. Now the first part, duodenum, has got actually it forms a C-shaped structure, and there is a C-shaped bend that I am not going to describe here, but this is the gallbladder which is present here, about which we are talking about. Now, what happens in the bladder? Gallbladder cancer is actually uncommon or less common cancer. It is discovered at its earlier stages, then the chances for a cure is very good. But most gallbladder cancers are discovered late, and therefore treatment becomes really difficult, outcome becomes poor. Gallbladder cancer may be discovered or may not be discovered until it is advanced, because it often causes no specific signs or symptoms. Also, relatively hidden nature of the gallbladder makes it easier for the gallbladder cancer to grow without being detected. The important signs and symptoms are abdominal pain that occurs in the right upper quadrant, that is the right hypochondrium, the abdominal bloating, losing weight, and yellowish of the skin and eyes, that is the jaundice. When should you see doctor? When you have symptoms, rush to the doctor to get the final answer. Somewhere in 1969, an old lady about 72 years was brought to me from a place in Haryana called Karnal. This lady had pain in the epigastrium and right hypochondrium, and this pain was quite severe, troublesome. The patient had complete loss of appetite and was feeling nauseated. She was losing weight and had become emaciated. She was admitted in our unit of medicine in female ward. We kept her. The pain was very severe. I myself saw the patient, and the opinion was that it is a carcinoma of the lung, that is the cancer of the lung, cancer of the liver. It was a case of cancer of the liver, not precisely liver, cancer of the gallbladder. There is a specific sign for the gallbladder. When we palpate the abdomen, we put our hand down and slowly go up, and as it touches the gallbladder, the patient winces. That tells us that the gallbladder is tender and we can locate it. So there are a number of investigations. You can do the CT scan, you can do MRI, you can do ultrasound now, but at that time none of the investigations was available. I was told by the head of department that discharge this patient because there is no use of this thing, we cannot do anything. But I kept the patient because we were giving pethidine to relieve the pain of the patient. The consideration was that if the patient goes home, and that also in small town, who will look after this patient and who will give relief to the pain to the patient. My aim was only to give comfort to the patient as far as possible. And next day the patient died in the ward, and we had to explain to the patient relatives that this was the cancer and that has taken the life of the patient. So we sent the dead body with heavy heart, but that is what happens in the medical practice. So friends, thank you very much. Today you have seen a case of cancer of gallbladder. Go and read from your books or from whatever source you have got and learn about the cancer of the gallbladder. Thank you very much. Meet you next time with another interesting case.